There's something you're probably doing right now, something millions of people your age do without a second thought, that might be slowly changing the structure of your brain. Not tomorrow, not in 5 years, but possibly right now, as you're watching this. The strange part? Most people don't even realize it's happening. Stay with me, because in the next few minutes, I'm going to show you exactly what's going on inside your head, and more importantly, what you can actually do about it. The truth is, we've been told our whole lives that certain things are completely safe. We trust them. We've used them for decades, maybe since we were young. But neuroscience has quietly uncovered something that's changing how doctors now think about brain health in people over 55. And here's what makes this urgent. The damage isn't always obvious until it's harder to reverse. One of my colleagues recently told me about a patient, a sharp, independent woman in her late 60s who came in confused about why she kept forgetting conversations from just hours before. Her family thought it was early dementia, but when we looked at her daily routine, we found something else entirely. That's what I want to walk you through today, not to scare you, but to give you the information your doctor might not have connected yet. Before we get to what's actually happening, you need to understand one simple thing about your brain that most people never learn. Your brain runs on chemical messengers. Think of them like the postal service of your mind. They deliver signals that let your brain cells talk to each other. One of these messengers is called acetylcholine. It's absolutely critical for 3 things: forming new memories, staying focused, and keeping you thinking sharp. Here's the part that changes everything. Certain things we use every day can quietly reduce how much acetylcholine your brain has access to. And when that happens, the brain doesn't just get a little foggy. The consequences are measurable, real, progressive. Now, you might be thinking, how could something I do every day be that harmful if it's available everywhere? That's actually the exact question we should be asking. There's a category of things millions of people take daily, and I mean millions, without any warning about what they might do to memory function. Some are prescription, some you can buy at any pharmacy without even talking to anyone. The concerning part isn't any single one of them. It's that most people don't know they're doing something that affects the brain at all. Let me give you a concrete example. There's a common over-the-counter product that people reach for multiple times a week, for sleep, for allergies, for that scratchy cold feeling. It's in almost every medicine cabinet in America. Most people think of it as harmless. It's so accessible, it must be safe, right? But research from the past few years has revealed something unexpected. People who use this regularly show measurable changes in the part of their brain responsible for forming new memories. We're not talking about minor changes. We're talking about the kind of changes that show up on cognitive testing, the kind that people themselves start to notice. They can't remember why they walked into a room, or they forget names of people they've known for years. Here's the thing, though. Most people never connect it back to what they're taking. They just assume it's normal aging. And that assumption is exactly the problem. Now, before I tell you exactly what this product is and what you should do instead, I want you to think about something. How many different things are you taking right now? Not just prescriptions, anything. Over-the-counter stuff, supplements, that thing you take before bed. Hold that thought, because it matters more than you realize. Most people think they're taking maybe 3 or 4 things, but when they actually sit down and list everything, the sleep aid, the allergy medication, the pain reliever, the cold medicine they grab, maybe a supplement for memory or joint health, the number is usually much higher. And here's where it gets serious. When you combine things that each have a mild effect on your brain, the combined effect isn't just a little more, it's exponentially worse. This is something we're only now fully understanding, and it's not being talked about nearly enough. Let's say you take something for sleep. It has a subtle effect on how your brain's chemical messengers work. Then you take something for bladder control. That has a similar subtle effect. Then maybe something for pain or mood. Each one on its own might cause barely noticeable changes. Your doctor prescribes them, so you trust they're okay. You don't feel dramatically different. But your brain is experiencing something much bigger. When multiple substances are interfering with the same system simultaneously, it's not like 1 + 1 = 2. It's more like each one amplifies the effect of the others.
The compounding happens at the cellular level. Recent large studies tracking thousands of people over years have found something striking. Older adults taking multiple medications with this particular property show significantly higher rates of cognitive problems than those taking just one or none at all. The troubling part? Most of these people had no idea they were creating this scenario. No one at the pharmacy pointed it out. No one at the doctor's office connected the dots. This is the part where most health videos would make you panic. I'm not going to do that. Instead, I'm going to give you what actually helps. The good news is that this is one of the most preventable cognitive problems we know about. Here's what you need to do, and it's simpler than you'd think. First, pull together every single medication and supplement you take. Everything. Write it down. Don't rely on memory. Second, ask your pharmacist, not your doctor necessarily, your pharmacist, to review the list and specifically tell you if any of them have effects on memory, focus, or brain chemistry. Pharmacists have software that flags this. It's literally their job. Third, if you find something that might be interfering, don't stop it immediately, but do schedule a conversation with your doctor about whether it's still necessary, whether the dose can be reduced, or whether there's a safer alternative. Fourth, and this is important, if you notice brain fog or memory changes after starting something, that's real. That's not normal aging. That's your brain telling you something. The encouraging part is, unlike many age-related cognitive issues, drug-related brain changes are often reversible. When you remove what's causing the problem, many people experience real improvement in mental clarity within weeks or months. Your brain can recover, but only if you give it a chance by removing what's harming it. I know this might sound like a lot of information, but think about what you're protecting. Your independence, the memory of the people you love, your ability to live the life you've built. That's not a small thing. One more thing I want you to understand. This isn't about being afraid of medicine. Modern medicine saves lives. It's about being informed. It's about knowing that every single substance you introduce into your body has effects, some helpful, some less so. Your job is just to know the difference. The seniors I see who age most successfully aren't the ones who avoid medicine. They're the ones who question it, who stay curious, who don't assume something is safe just because it's been around for a long time or because they can buy it without a prescription. That kind of awareness is protective, it's empowering, and it's something you can start today. So here's what I want you to do this week. Sit down with that list of medications. Just make the list. That's the first step. If this information resonated with you, or if you're realizing you need to have this conversation with your doctor, subscribe. I create content specifically for people who want to understand their health instead of just following orders. Because that kind of understanding is how you stay sharp, independent, and genuinely healthy as you get older. Thank you for watching. Your brain will thank you for paying attention.